specifically with Medicaid, out-of-state access. So if you have someone in Pennsylvania, for example, can that Medicaid consumer access care in West Virginia, in Ohio, or New York or New Jersey, wherever it is, can they access care out of the state? Good morning, insurance agents in the senior market. Welcome back to another episode of Near and Far. It is Monday, June 7th. Thank you for starting your week with us. We're really excited to start our week with you. So this is the fourth episode from our 1,000 subscriber celebration. We want to thank all of you so much for the great ideas that you sent to us, all of those content submissions. If you've got a new idea of something you'd like to see us cover on Near and Far, someone you'd like to see us talk to, or a subject you'd like to see us get into, hit us up here at nf_studios@neishloss.com, and we'd love to put together the content that you're looking for. So today's episode comes from a request from Mike Loro. So Mike, want to thank you so much for this great idea. You've got those $250 worth of Amazon gift cards coming your way. Hope you get a whole host of goodies that you can enjoy, and we'd love to hear what you ended up getting with them. So specific to this, Mike has also started his own YouTube channel. So Mike had watched a lot of what we were doing, decided he wanted to get into building video content specifically for his members and prospects. If you'd like to check out Mike's channel, you can see the link to it in the description for this video. Now, Mike's request focused on Medicaid, and specifically with Medicaid, out-of-state access. So if you have someone in Pennsylvania, for example, can that Medicaid consumer access care in West Virginia, in Ohio, or New York or New Jersey, wherever it is, can they access care out of the state? So let's first talk about how Medicaid differs from Medicare. So Medicaid is a state-run program. Now, there are funds from the federal government that support the Medicaid programs in the various states, but again, this is a program run by the state. So it stands to reason that if it's a state-run program, there's going to be no out-of-state access. Now, this is generally accurate. However, there are exceptions here. First would be in emergency care. We've done on a previous episode of Near and Far talking about emergency care and what is really the standard. Does it mean that you've got a gaping wound, that you're bleeding out, that you're having a heart attack, or is it something else? So as we've discussed before, emergency care is care that cannot be reasonably postponed until you return to the service area. So it doesn't necessarily mean that you're bleeding out, but you really don't have the time or the ability to wait till you return to your home service area to receive that care. So emergency care, Medicaid will cover. There's also border scenarios, and I've looked at a number of state Medicaid guidelines, and what almost all of them talk about is in these scenarios with prior approval from the state Medicaid office, you may be able to access care across the border of a different state, but certainly need to reach out and discuss that with your state Medicaid office before you go and seek that care. Now, D-SNP may be your best answer here. So D-SNP is, again, dual special needs plans, and we do a lot of talking about D-SNP product here on Near and Far, as well as many of our other shows. So, but if you have a consumer who's on Medicare and on Medicaid, many D-SNP products offer out-of-state providers as in-network providers as part of their plan. So, that may be your best option. So I'll give you an example. Let's say that you live in Lawrence County, Pennsylvania, in and around Newcastle. Maybe you want to access providers in the panhandle of West Virginia, in Weirton and Wheeling. Maybe you live in Fayette County, Pennsylvania, and you'd like to go to Morgantown to access providers in West Virginia. A dual special needs plan may be the best and most convenient way for that member to access care on a non-emergency basis outside the network. So if you'd like more information on this, if you'd like to discuss specifically your area of the country, D-SNP products that are available, and how they may be able to offer Medicaid members in your area coverage out of state, contact us. Give us a call, email the show. We're happy to get you in touch with our sales team, and they will be able to circle up with you and help you find the answer to your specific question in your specific market. So we will be back with you on Wednesday, June 9th at 7 a.m. I'm Bill, and this has been Near and Far. Enjoy your Monday.